Hi everyone, I'm Dr. Danny, and today I'm going to walk you through Parkinson's disease. I'm going to explain the basic definition of Parkinson's disease, its symptoms, now what causes Parkinson's, its associated risk factors, diagnosis, how is it prevented, its treatment, and conclusion. Now, what is Parkinson's disease? Parkinson's disease is a chronic progressive disorder that involves a part of the brain called the substantia nigra. Now, the substantia nigra is a part of the brain that produces a neurotransmitter called dopamine. This neurotransmitter is involved with certain processes in our brain, such as muscle movement, and it's also the reward and pleasure centers in the brain. Now, a decrease in this neurotransmitter would lead to a decrease in the movements, and it also is going to lead to a decrease in certain communication centers in our brain. Now, this is what leads us to the symptoms of Parkinson's disease. Now, Parkinson's disease affects the basic life activities, making it difficult to easily diagnose Parkinson's disease. Now, it could interfere with the simple brushing of the teeth. Now, someone who has Parkinson's wouldn't really know because you could just be brushing your teeth. Then you just find your hands shaking a little bit. You just think it's nothing serious, but then it's one of the symptoms of Parkinson's, and if left untreated, leads to more progressive symptoms over time, making it difficult to properly find the treatment plan. Now, the associated symptoms with Parkinson's include tremor. Now, this is just like a shaking of the hand, just like I just mentioned, and it's usually affected, which begins with your limb, and often with your hands and fingers. That's where it's first noticed. Then we also have slow movements. Now, slow movements has to do with dopamine, neurotransmitter dopamine, which I just mentioned. Now, you have no control over any movement to your body, which I also mentioned here with loss of automatic movements. Now, Parkinson's leads to a decrease in the muscle connections in the brain, and it leads to a decrease in how you walk. Like you can just find yourself not able to perform simple tasks, and it also leads to rigid muscles. Like these rigid muscles this only affects specific parts of the brain. It could be like your arm or the leg or just muscles around your brain, and it makes it difficult and painful to easily move your hands and perform simple tasks. Now, Parkinson's also leads to impaired posture in the sense that it makes it difficult to properly stand, leading to a stooping or bending over in the back, and difficulty maintaining the proper posture. Now, this also affects the speech. Now, someone with Parkinson's will have to talk so slowly and have to think properly before making certain conversations. Now, Parkinson's has a very linear relationship with dementia, which is what I call memory loss in our slide here. Now, this interferes with basic things of your life, and you might not remember certain things that happened yesterday or 3 minutes ago. It just depends on each person. And yeah, note that these symptoms are different for each individual. Now, person A with Parkinson's can experience tremor and impaired posture, then also changes in speech. Or person B could experience tremor, rigid muscles, and memory loss. Now, with these symptoms are all linked together, but it's very different and specific for each person. Now, this is the case with several neurodevelopmental disorders. Now, what causes Parkinson's disease? Yeah. So, on the slide here, I have genetic factors, environmental factors, presence of Lewy bodies, and alpha-synuclein found in Lewy bodies. Now, Parkinson's isn't caused by just genetic factors or environmental factors. All these causes are all linked together. Now, I know we have genes, and having And note that having a genetic factor or having a hereditary factor might not necessarily mean you might develop Parkinson's over time. You could have the genetic factor, but coupled with a healthy lifestyle, you could definitely not experience the symptoms of Parkinson's over time. Now, when I mean environmental factors, this has to do with our exposure to stressors, such as maybe you tend not to sleep properly because of school, or maybe you have two jobs and then you don't have enough time to rest, and every time you're on the go. Now, this predisposes you to a lot of neurodevelopmental disorders, not just Parkinson's. Now, we also have the exposure to certain toxins, such as pesticides or herbicides. Now, inhalation of these toxins affect certain systems in our body systems. You could have the genetic factor you might not know, and inhalation and exposure to these toxins could lead to an increase in the genetic factors in our bodies, leading us to Parkinson's disease. Now, Lewy bodies are certain clumps or molecules in our brain that are found in our brain that interferes with the normal functioning of our brain functions and leads to Parkinson's. These little clumps also have several molecules in them, but the presence of one molecule called the alpha synuclein, just like I mentioned in the slide there, also increases the risk of developing Parkinson's. Now note that on this slide, I mentioned four things, but not each of these, no, not just one of these four things causes Parkinson's, but the relationship between each and every one leads to Parkinson's disease. Okay, yeah. So now we have the risk factors associated with Parkinson's. Now the major one is age. The average age for patients with Parkinson's is 60 years. Now yeah, that's older, but Parkinson's disease is rarely ever found in youth of like 20s. In some cases it's found in youth, but in like mid 20s, late 20s. But the major age range for Parkinson's is about 50 to 60 years of age. Now, hereditary factors. Now, just like I mentioned in my previous slide, I said genetic factors is a cause of Parkinson's. But you could have the genetic factors, but still not develop Parkinson's. Now, this has to do with your lifestyle, just like I also mentioned previously. Now, genetic factors, let's say a family member has Parkinson's. Now you have that trait in your body system. You need to watch how you treat yourself and how you eat in your environment. Now, another risk factor I have is sex. Now, statistics have shown that men tend to be diagnosed more with Parkinson's than women. Then I also mentioned in the previous slide that exposure to toxins such as herbicides and pesticides increases our risk factors. Then I also have head trauma. Now, head trauma is not just associated with Parkinson's, but with several disorders. Then I also have smoking. Now, you see, if you look at all these risk factors, every single one of them can also be found with several chronic diseases. Now, this tells us that now the only factor that might be very different would be the genetic factors, because we have different genes specific to some of these neurodevelopmental disorders. Yeah. So how do we diagnose Parkinson's? Now on this slide I have mainly imaging testing, but I'm going to tell you what. Now, diagnosis of Parkinson's isn't just a linear relationship, isn't just a straightforward process. Now, just imagine I have on the screen here imaging scans of a normal person's brain and a brain of someone with Parkinson's. Now, this only shows us the different parts of the brain that tends to be degraded over time due to the progression of this disease. But not one single test can help to diagnose Parkinson's. While the scans may be very would be very helpful. It helps us to narrow down the disorders associated with these certain symptoms because certain neurodevelopmental disorders have very similar symptoms. Now, if you go back to our previous slide, I said a symptom of Parkinson's is memory loss. Now, Alzheimer's patients now also have memory loss. Now, having this specific symptom would not mean that you have Alzheimer's and Parkinson's. That's why we always have to do scans because, just like I mentioned in my previous slide, Parkinson's has to do with the substantia nigra, but with other neurodevelopmental disorders, it has to do with different parts of the brain. Now, the major thing that helps us to understand Parkinson's, that helps us to diagnose Parkinson's properly, is the presence of these symptoms. Now, we can do blood tests or imaging tests to help us to diagnose Parkinson's, but the symptoms are mainly are different for every patient, but they're mainly associated with Parkinson's. Like it helps us to know oh, this is what this patient has. Now, all the blood tests, coupled with the imaging tests, coupled with the symptoms, helps us to narrow down different disorders to Parkinson's. So I mentioned in my previous slide the risk factors, the causes of Parkinson's. I'm sure you have a really good idea on how it can be prevented. I'm just gonna go down. So we'll talk about how it can be prevented. So yeah, these strategies I have listed broken it down into three parts. We have the primary, secondary, and the tertiary preventative strategies. Now for the primary, this is right before you have Parkinson's. This is right before you are diagnosed with Parkinson's. For the secondary, this is when you have been diagnosed with Parkinson's, but it's still in its early stages. Now with tertiary is when you know you have Parkinson's. Now for the primary preventative strategies, I'm sure you can take a good guess on what I mean by this. Now, as Parkinson's has no cure, several neurodevelopmental disorders have no cure. Now, the risk of developing this disease can be easily managed when we break it down to our lifestyle changes or certain things in our environment. Now, when I mean lifestyle changes, I mean having proper exercise. You don't have to wait until you're diagnosed with Parkinson's or any other disease before you have to do exercises. Now you also watch what you eat. You should try to eat more fruits in high fiber, like more fruits and vegetables and foods with high fiber content. Go organic. Now, treatment of these neurological signs and symptoms in order to prevent Parkinson's from ever developing. Ever developing. So yeah, I'm gonna move on to secondary preventative strategies. Now, what do I mean by secondary preventative strategies? Now, for example, you know that let's say your mom or your grandpa or someone in your family has Parkinson's. And you know, in a way, before you do the test, you have the hereditary factors that already predisposes you to having Parkinson's. And you're going to watch out for certain behavioral changes. So this helps to quickly find out the early symptoms of Parkinson's and also helps to quickly treat these symptoms. And this gives you more years because having Parkinson's already shortens the lifespan of patients. And that really gives you a maximum of like 10 to 12 years. This gives you more years to live, and it also helps to decrease the rate of progression as time goes on. Now, the tertiary preventative strategies. Now, this is how you try to prevent it after you have been diagnosed with Parkinson's, and you know that yes, I have this. Performing regular physical activities, then use of medications, which I will be discussing in my next slide. And for electroconvulsive therapy, this would mainly be important for individuals that have a link between Parkinson's and depression. Now, you will be surprised to know that about 50% of individuals with Parkinson's tend to develop depression over time. I know it's really sad, but yeah. Electroconvulsive therapy also treats depression in individuals with Parkinson's disease. So yeah. For treatment, we have certain medications, surgical procedures, and the most important one, changes in lifestyle. Now, for medications, I have levodopa as the first one. Now, all of these levodopa, dopamine agonists, and COMT inhibitors, the name is too long, I'm not going to mention that now. Now, all of this has to do with the increase of dopamine in our cells. If you remember back to our very first second slide, I talked about how a decrease in dopamine leads to most of these symptoms associated with Parkinson's. Now, these drugs would help to increase the production of dopamine in our cells. But since dopamine, the neurotransmitter dopamine, can't exactly enter into our brain cells, we try to break it down into substances like levodopa and certain dopamine agonists that would easily cross the brain-blood barrier and help us to increase the production of dopamine. Then COMT inhibitors also prevent the breakdown of dopamine in the cells. Yeah. We have surgical procedures. Now, surgical procedures is mainly used for the really extreme cases of Parkinson's. Surgical procedure that is mainly used for extreme cases of Parkinson's, it's called deep brain stimulation. So in this method, now surgeons try to implant electrodes into a specific part of the brain, and the electrodes are connected to a generator implanted in our chest near our collarbone. So this sends electrical impulses to your brain and also reduce Parkinson's disease symptoms. Now this is in really extreme cases of Parkinson's disease because this method is very invasive and you wouldn't want to go undergo surgery for the very little symptoms with Parkinson's. Now overall, the most important one, lifestyle changes. Now several chronic diseases are associated with eating properly, and not just chronic diseases and even little illnesses. You're not like watching your food you eat, like avoiding fast food and making your food more nutrient based instead of zero calories. Try to exercise more and also try to avoid falls. If you remember back to our previous slide, I talked about a trauma being related to a cause of Parkinson's. Um, Now this is our last slide. Now I hope I've been able to give you a strong overview of what Parkinson's disease is, and I hope I've been able to impact you and how you would be able to watch what to eat and how much Parkinson's really affects the lives of individuals. Now thank you for listening to my presentation, and I hope you have a wonderful holiday this season.